Hello and welcome. Today we're delving into a complex and often challenging eye condition, intraocular tumor-associated glaucoma. This is a type of glaucoma that arises secondary to the presence of a tumor inside the eye. Understanding this condition is crucial for early detection and effective management, so let's explore its various aspects. So, what causes this specific type of glaucoma? Well, intraocular tumor-associated glaucoma, as the name suggests, is primarily caused by the presence of an intraocular tumor. These tumors can be benign or malignant, and the most common culprits are melanoma, retinoblastoma, and metastatic cancers that have spread to the eye from other parts of the body. These tumors can trigger glaucoma through several mechanisms that we'll discuss shortly. Now, let's discuss the underlying mechanisms that link a tumor to glaucoma. There are several ways intraocular tumors can raise the intraocular pressure, leading to glaucoma. Firstly, the tumor itself can directly obstruct the trabecular meshwork, which is responsible for draining fluid from the eye. Secondly, tumor cells or inflammatory debris shed from the tumor can clog the drainage pathways. Thirdly, the tumor can induce neovascularization, which is the growth of abnormal blood vessels in the angle of the eye, obstructing the drainage system, leading to neovascular glaucoma. Finally, in rare cases, the tumor can cause angle closure, where the iris is pushed forward, physically blocking the drainage angle. Unfortunately, precise epidemiological data specifically for intraocular tumor-associated glaucoma is limited. This is because it's a relatively rare condition. However, we know that the incidence is directly tied to the prevalence of intraocular tumors. Therefore, risk factors for intraocular tumors, such as age, genetic predisposition, and certain inherited conditions, can indirectly influence the occurrence of this glaucoma type. Furthermore, individuals with a history of cancer in other parts of the body, especially melanoma, should be vigilant for any changes in their vision. Identifying intraocular tumor-associated glaucoma often requires a keen eye and attention to specific symptoms. Patients may experience the typical symptoms of glaucoma, such as blurry vision, halos around lights, and peripheral vision loss. However, they might also experience symptoms related to the underlying tumor, such as floaters, flashes of light, a dark spot in their vision, or even pain in the eye. It is crucial to note that the onset of glaucoma symptoms in conjunction with these other visual disturbances should raise suspicion for a possible intraocular tumor. Diagnosing intraocular tumor-associated glaucoma requires a comprehensive eye examination. This includes measuring intraocular pressure, examining the optic nerve for signs of damage, and assessing the angle of the eye where fluid drains. Gonioscopy allows the doctor to view the drainage angle and identify any obstructions. Crucially, imaging techniques like ultrasound, optical coherence tomography (OCT), and magnetic resonance imaging (MRI) are vital for visualizing the tumor itself and determining its size, location, and relationship to surrounding structures. Biopsy, while sometimes necessary, carries risks and is carefully considered based on the clinical picture. While we don't typically classify intraocular tumor-associated glaucoma into distinct types, in the same way we do with primary glaucomas, we can categorize it based on the mechanism by which the tumor causes the pressure increase. For instance, we can differentiate between angle closure glaucoma caused by the tumor pushing the iris forward, open-angle glaucoma caused by tumor cells clogging the drainage pathways, and neovascular glaucoma resulting from new blood vessel formation. The treatment and management of intraocular tumor-associated glaucoma are complex and multifaceted. The primary focus is on addressing the underlying tumor. Treatment modalities for the tumor may include radiation therapy, chemotherapy, laser therapy, or surgical removal. Regarding glaucoma management, medications to lower intraocular pressure, such as eye drops, are often used. In some cases, laser procedures like laser peripheral iridotomy or selective laser trabeculoplasty may be considered. However, these procedures are often less effective in tumor-associated glaucoma. Ultimately, glaucoma surgery, such as trabeculectomy or glaucoma drainage device implantation, may be necessary to control intraocular pressure. It's crucial to coordinate treatment between an ophthalmologist specializing in glaucoma and an ocular oncologist. Unfortunately, there's no specific way to prevent intraocular tumor-associated glaucoma, as it's secondary to the development of intraocular tumors. However, early detection of intraocular tumors through regular eye exams, especially for individuals with risk factors, is critical. Early diagnosis and treatment of the tumor can potentially prevent or minimize the glaucoma's severity and progression. The prognosis for intraocular tumor-associated glaucoma depends heavily on several factors, including the type, size, and location of the tumor, the effectiveness of tumor treatment, and the severity of glaucoma at the time of diagnosis. Early detection and aggressive management can improve outcomes. Research in this area is ongoing, with studies focusing on novel therapies for intraocular tumors and more effective methods for managing the associated glaucoma. Gene therapy and targeted drug delivery are promising avenues currently being explored.